Good morning, everyone. The name of our lecture is Functions of the Peripheral Endocrine Glands. What we are going to start today, it's hormones of thyroid gland, and their function, endocrine function of the parathyroid gland, adrenal gland and their hormones, endocrine part of the pancreas and its hormones, diabetes mellitus and its consequence, endocrine tissue of other systems, and hormones of interaction. So let us start. First of all, let us stop on the thyroid gland. The thyroid gland lies anterior of the thyroid cartilage of the larynx. It consists of the two lobes and connected by the narrow isthmus. Thyroid gland mainly consists of the thyroid follicles, which hollow spheres lined by cuboidal epithelium. Cells surround the follicular cavity that contains viscous colloid, surrounded by a network of the capillaries that deliver nutrition and regulatory hormones and accept secretory products and metabolic waste. Thyroid gland produces thyroid globulin. It's a globule protein, which is synthesized by the follicular cells, secreted into colloid of the thyroid follicles. Molecules contain the amino acid tyrosine, which is converted to the thyroxine T4, also called like tetrathyroidine, and contains 4 iodine ions, and 3-thyroidine T3, which contains 3 iodine ions. So they T3 and T4, they are main hormones of thyroid gland. Hormones of thyroid gland are bounded in the blood with thyroid binding globulins, plasma proteins that bound about 75% of T4 and 70% of T3 entering the bloodstream. Transferrin, thyroid binding prealbumin, and albumin binds most of the remaining thyroid hormones. About 0.3% of T3 and 0.03% T4 are unbounded, and only these percentages and only these hormones will be active and effect on the target cells. What are the main effects of the thyroid hormones? They enter target cell by the transport system, affect most cells in the body, bind into the receptors in cytoplasm, surface of the mitochondria, nucleus. As a result, they're responsible for the development of these cells. In children, they are essential for the normal development of the skeletal muscles and nerve system. Cholinergic effect. Cell consumes more energy, resulting in increased heat generation. Also, thyroid hormone responsible for strong, immediate, and short-lived increased rate of the cellular metabolism. Effects of thyroid hormones on peripheral tissue. T3 and T4 will be responsible for elevation of rates of oxygen consumption and energy consumption. In children, may cause a rise in the body temperature. Increased heat rate and force of contraction generally result in the rise of the blood pressure. Increased sensitivity for sympathetic stimulation. Maintains normal sensitivity of respiratory center to change in oxygen and carbon dioxide concentration. Stimulate red blood cell formation and thus enhance oxygen delivery to the tissue. Stimulates activity in other endocrine tissues, accelerates the turnover of minerals in the bones. This is a function of the calcitonin. How the production of the thyroid hormones is happened. So, first of all, for producing of the thyroid hormones, we require some kind of stimulus. The stimuli for production of the thyroid hormones will be called temperature. Cold temperature is a stimuli. As a result, it's going to influence on the hypothalamus, which is going to release thyroid-releasing hormone. Thyroid-releasing hormone causes cells of anterior pituitary gland to secrete thyroid-stimulating hormone, which further is going to affect on the thyroid gland. As a result, it will cause thyroid gland to produce more T3, T4 hormones. When the level of T3 and T4 will increase in the bloodstream, due to the negative feedback, they will send information back to the hypothalamus and pituitary gland, and as a result, they will inhibit production of thyroid-releasing hormone and thyroid-stimulating hormone as we deal with our stimuli called intolerance will increase temperature in the body. The target cells, T324 will be responsible to increase process of metabolism, to increase body temperature, increase normal and gross development of the cells. What is the physiological effects of the calcitonin? Calcitonin generally will produced by the cyst cells. Another name of them is the parafollicular cells. Calcitonin is responsible for regulation of the calcium in the body fluid. What is its effect? It will inhibit osteoclast, which slows the rate of calcium release from the bone. It will stimulate calcium excreted by the kidneys, but also not only calcium is going to excrete it, the phosphates also is going to excrete it, so the level of calcium and phosphate are going to decrease. What diseases are related to the thyroid gland? So, in adult people, the hypofunction of thyroid gland is presented by the myxedema. It's accumulation of the mucoprotein and fluid in subcutaneous tissue. Symptoms which are related to the myxedema is decreased metabolic rate, weight gain, decreased ability to adapt to the cold, and lethargy. Graves' disease, which is common for the hypersecretion of the thyroid gland. It is autoimmune disorder which exerts of the thyroid stimulating hormone-like effects on thyroid. It doesn't have any kind of negative feedback. Graves' disease happened due to the producing of the thyroid stimulating immunoglobulin, which will affect on the influence on the thyroid gland and stimulate it to produce more T3T4. During this kind of disease, the level of T3T4 is going to be high, but the level of TSH will become low. It's happening due to the influence of the thyroid stimulating immunoglobulin. Cretinism, which is common only for children, is caused by the lack of thyroid hormones from the first trimester of the pregnancy to the 6 months of postnatal period. It is characterized by the several severe mental retardation. Why is this happening? As we discussed previously, thyroid hormones is this kind of hormones which affect on the membrane of the nucleus and could affect on the producing of the DNA and RNA. So in this way, they're responsible for the development. During the pregnancy or the postnatal 6 months of the postnatal period, if the iodine deficiency, thyroid hormone deficiency, nervous system will not develop properly. And that is why such children are going to have the problems with development of the nervous system, problems with the mental and other mental disorders. In this picture, you could see the diseases which are related to the thyroid to the thyroid gland. So on the first picture, figure 13.21, it's a cretinism due to the underactive thyroid during the infancy and childhood. On the figure 13.22, it's goiter. It means the enlargement of the thyroid gland. In this case, it happened due to the iron deficiency. In the figure 13.22, we have the example of the Graves' disease, which may cause eyes to protuberate, which is called exophthalmos. Okay, let us go on. The parathyroid gland. As we discussed, parathyroid gland, there is 4 parathyroid glands, which will be embedded on the posterior surface of the thyroid gland. Parathyroid gland produces parathyroid hormone. Another name, it is a parathormone. Produced by the parathyroid cells, it is responsible to, in response to a low concentration of calcium in the blood. It is antagonist to the calcitonin. What are the main effects of parathyroid hormone? It stimulates osteoclast and inhibits osteoblast. As a result, due to the stimulation of the osteoclast, calcium is going to remove from the bone. Reduce rate of calcium deposition in the bone. It inhibits reabsorption of calcium at the kidney, but reducing urinary losses, but at the same time, it will increase excretion of phosphates by the kidney. It stimulates formation and secretion of calcitriol by the kidney. Its effect complement on the NH of the parathyroid hormone. Also, it inhibits calcium and phosphate absorption of the digestive tract. So, now let us discuss the homeostasis and disturbance according to the calcium level. So when we have increased level of calcium, rising level of calcium in the blood, thyroid gland is going to produce calcitonin. As a result, calcitonin is going to inhibit osteoclast. So as a result, calcium will deposit in the bone. Besides this, calcitonin will be responsible for increased excretion of calcium by the kidney. If we have another situation when the level of calcium is going to be low or decline, so in this variant, parathyroid gland is going to produce paratroop hormone, which will affect on the bones and responsible for releasing of calcium through the function of the osteoclast. And what about kidney? Paratroop hormone will affect on the kidney, and as a result, calcium is going to be reabsorbed back to the bloodstream. So in this way, the level of calcium is going to increase. Here in this picture, we could see what happened when the pooling of calcium in the blood. Parathyroid hormone is going to influence on the bones. Calcium will release from the bone. Second wall, increased reabsorption of calcium by the kidney, and also increased calcitonin production, which will cause calcium absorption by the digestive tract. So as a result, the level of calcium in by this mechanism are going to increase. Let us go on, and now let us talk about the adrenal gland. The adrenal gland lies along the superior border of each kidney. It's subdivided into the superficial adrenal cortex. Adrenal cortex mainly produces steroid hormones. In adrenal medulla, it's going to produce the catecholamines, norepinephrine and epinephrine. But also, this production of epinephrine and norepinephrine is going to be controlled by a sympathetic division of autonomic nervous system. And it's responsible for metabolic changes which will persist for several minutes. Adrenal gland, adrenal cortex consists of the three regions: zonal glomerulosa, zonal fasciculata, and zonal reticularis. Each of these zones is going to produce hormones, about what we are going to discuss a little bit later. Zonal glomerulosa is going to produce hormones which are called aldosterone. Zonal fasciculata is going to produce hormones which are called cortisol. And zonal reticularis is going to produce androgens. What is interesting is that adrenocorticotropic hormone will generally have influence on the adrenal cortex, but mainly on the zone of fasciculata and zone reticularis. It doesn't have effect on the zonal or zone glomerulosa, which produces aldosterone. Let us go on. So, zonal glomerulosa, it's outer region of adrenal cortex, which produce mineralocorticoids. The example of mineralocorticoids is aldosterone. What is the main function of aldosterone? Aldosterone stimulates conservation of sodium ions and elimination of potassium ions. It increases sensitivity of salt receptors in the taste buds. Secretion responds to drop in blood level of the sodium ions, blood volume, and as a result, blood pressure. And besides this, it increased level of potassium in the blood. So this will be the stimuli for production of the aldosterone. Also, aldosterone is a part of the renin-angiotensin-aldosterone pathway. Let us a little bit discuss this pathway. So, on the first stage, we have this first stage we could name even the stimuli. We have the hydration and the sodium deficiency. As a result, it will lead to the decrease in the blood volume and as a result, decrease in blood pressure. Decreased blood pressure will be detected by the cells of the kidney, which are called extraglomerular cells. These cells are going to release the renin. What is the function of renin? Renin is going to convert angiotensinogen, which is produced by the liver, to angiotensin 1. Increased level of the angiotensin 1 active form will deliver to the lungs. In the lungs, angiotensin 1 is going to convert to the angiotensin 2. This mechanism will happen due to the presence of the enzyme which is called angiotensin converted enzyme. As a result, angiotensin 2 is going to have several effects. The first effect is it will be responsible for vasoconstriction of the arterioles, and as a result, in this way, blood pressure is going to increase. Second of all, it will influence on the adrenal cortex, and adrenal cortex is going to release aldosterone. Now, what is the function of aldosterone? Aldosterone will affect on the kidney, and it will be responsible to increase reabsorption of sodium. As a result, blood volume will increase, so it also will support to increase blood pressure. Besides this, it's going to be responsible to increase reabsorption of sodium and excretion of potassium. So the level of potassium in the blood is going to decrease. Okay. Now let us go on. Zona fasciculata, which are responsible for production of the glucocorticoids. The example of the glucocorticoids is cortisol and corticosterone. Liver is responsible to convert cortisol to the cortisone. Secretion regulated by the negative feedback of the pituitary gland, which produces adenocorticotropic hormone. Which has in this secretion regulated by negative feedback, which has inhibitory effect on production of cortico-releasing hormone of the hypothalamus and adenocorticotropic hormone in adenohypophysis. This negative feedback will be done only in case if the level of cortisol will increase, and as a result, it will have negative effect on CRH and ACTH. Glucocorticoids have their main function. They accelerate glucose synthesis and glycogen formation. They show anti-inflammatory effect, which is happened due to the inhibit activities of the white blood cells and other components of the immune system. Zonal Reticularis, it is a network of the endocrine cells which forms narrow band bordering each adrenal medulla. It produces androgens under stimulation by adenocorticotropic hormone. On this slide, I would like to show you the disorders which are related to the adrenal cortex. The first one, it is a Cushing Syndrome, which happened due to the increased production of the cortisol. So, what will be the symptoms? Moon face, red striation, thin skin, high blood pressure, hyperglycemia, thin arms and leg, weight gain, which will be supposed on the abdominal cavity. The adrenal medulla. As we discussed, the adrenal medulla contains two types of secretory cells, which are responsible for production of epinephrines, about 80%, and norepinephrine, about 20–25% of its secretion. Now let us return back to the Cushing syndrome. So what I want to show you is better to make the differences between Cushing syndrome and Cushing disease. Cushing syndrome is caused by the hormonal tumor of the testicular layer. As a result, increased production of the cortisol. Or it could happen due to the oral corticosteroid medication, which could lead to increased level of the cortisol in the blood and have such kind of adverse effect like we discussed previously. Cushing disease is caused by the tumor on the pituitary gland that causes the gland to produce more cortisol through the influence of the adenocorticotropic hormone. And in this case, we are going to have as elevated ACTH and as elevated cortisol. Okay, generally, but nevertheless, the symptoms will be similar. Moon face, red striatus, high blood pressure, hyperglycemia. Another kind of disease which is related to the adrenal gland, it will be Addison disease, which is described like a chronic adrenal insufficiency. Mainly, this adrenal insufficiency will be deficiency of primary of the cortisol, deficiency aldosterone. Another names you could see in this picture that before how its man looks like and the after. So he's going to lose weight. He is going to have or has a high level of fatigue, and also you could see the another color of the skin, which is called the hyperpigmentation. Also, people with Addison disease will be intolerant to the stress because cortisol, production of cortisol is going to decrease. And also they will be intolerant to any kind of diseases because also this is due to the less amount of the cortisol, which generally and physiologically produce anti-inflammatory effect. Another but opposite situation, it is the primary hyperaldosteronism, during which we have increased level production of the aldosterone. And as a result, we are going to receive increased level as a result the absorption of sodium is going to happen, and besides this we will receive increased amount of potassium. So in the blood you will see the level amount of potassium. Hypokalemia, high and due to the reabsorption of sodium, which also responsible as a result indirectly to increase blood volume. Another symptom which will be common, it's increased blood pressure, which will lead to the hypertension, arterial hypertension. So in this picture, once more, we could see the Addison disease, a hyperpigmentation of the skin. This happened due to the ACTH has the same precursor as melatonin. So as a result, and we know that the melatonin is responsible, this is a hormone which is responsible for the pigmentation of the skin. So the pigmentation will happen of the fingers more common, of the lips, and around the eyes. What is the main effects of the catecholamines which are produced by the adrenal medulla? So activation of the adrenal medulla has the following effects. In skeletal muscles, epinephrine and norepinephrine will trigger mobilization of glycogen reserves and accelerate the breakdown of glucose to provide production of ATP. This combination increases both muscular strength and endurance. In adipose tissue, stored fats are broken down into fat acids, which are released into the bloodstream from the other tissue to use for ATP production. Epinephrine and norepinephrine also has effect in the liver, where glycogen is molecules of the glycogen will break down for the glucose, which further is going to use for producing of the ATP. Primary for used by neural tissue, which cannot shift to the fat acid metabolism. In the heart, epinephrine and norepinephrine will stimulate beta-1 adrenal receptors and trigger to increase the heart rate and contraction of the cardiac and increased contraction of the cardiac muscle. Pineal gland lies in the posterior portion of the roof of the third ventricle. It contains pinealocytes which are going to synthesize the melatonin. What is the main function of the melatonin? It's inhibit reproductive function, first of all. It protects against damages by the free radicals and influence in the circadian rhythm. The rhythm of the day of the light and light part of the day and night, and due to the seasons. Pancreas. Pancreas lies between the inferior border of the stomach and proximal portion of the small intestine. It is a mixed gland. It has exocrine and endocrine function. Exocrine function is presented by the enzymes, and endocrine function is presented by the hormones. Exocrine functions consist of the clusters of the gland cells called pancreatic acini and their attached ducts. Take about 99% of the whole pancreatic volume. Gland duct cells secrete alkaline, enzyme-rich fluid that reach the lumen of the digestive tract through the network of the secretory ducts. Endocrine pancreas, it consists of the cells that form clusters, not like pancreatic, its islands of Langerhans. Alpha cells will be responsible for production of the glucagon. Beta cells produce insulin, and delta cell will produce this peptide hormone which is common somatostatin, which is identical to the growth hormone inhibitory hormone, and F cells, which is responsible for secreting of pancreatic polypeptide. What is the main function of pancreatic hormones in regulation of the blood glucose level? So, when level of the glucose is going to rise, beta cells will secrete insulin, which is going to stimulate transport of glucose across the plasma membrane cells. Insulin generally will connect to three types of the tissues. It's to the liver, it's to the adipose tissue and skeletal muscles. To this three types of the tissues, the insulin is going to deliver glucose, which there is going to store in the compound like glycogen. When the level of the glucose is going to decline, alpha cells are going to release glucagon. Glucagon is also will affect on the adipose tissue, skeletal muscles, and the liver. In this tissue, it will stimulate glycogen to break down to produce glucose, to release glucose to the bloodstream, and in this case, to increase its level. So, what happened? Rising blood glucose level, beta cells will be secreted. As a result, increased rate of glucose transport into the target cells. We discussed what is the target cells. Increased rate of glucose utilization and ATP generation. Increased conversion of glucose to the glycogen. Increased amino acid absorption and as a result responsible for protein synthesis. Increased triglyceride and synthesis in the adipose tissue. When the level of glucose is going to decrease, in this case, now is going to rise level of the glucagon. Glucagon will be responsible for breaking down of glycogen in the liver. Further, when the level of glucose will increase for breaking down of proteins and producing amino acids, which will be used for gluconeogenesis, and for breaking down of the fats in case to release of fat acids, which also further is going to use for producing for mechanism of gluconeogenesis, production of glucose from the fat acids. So, as we talk, falling blood glucose level, alpha cells will secrete glucagon. Glucagon responsible to increase breakdown glycogen to glucose in liver, skeletal muscles, increase breakdown of fats, acids in adipose tissue, and increase synthesis and release of glucose by the liver. This will, and as a result, the level of glucose is going to increase. Main metabolic effects of the insulin. Insulin is a peptide hormone which will release of the beta cells, as we discussed. It affects on the target cells and responsible for accelerate of glucose uptake, accelerate glucose utilization and enhance ATP production, stimulate glycogen formation, stimulates amino acid absorptions and protein synthesis, and stimulates triglyceride formation into the adipose tissue. Glucagon is released by the alpha cells. It mobilizes energy reserves. On the target cells, it will be responsible for stimulation of breaking down of glycogen in skeletal muscles and liver cells to produce glucose, stimulate breaking down of triglycerides in adipose tissue and further used in the gluconeogenesis, and stimulate producing of glucose in the liver through this mechanism is called gluconeogenesis. The disorders which are related to the pancreas, it is diabetes mellitus, which is characterized by glucose concentration high enough to overwhelm for the reabsorption capabilities of the kidney. Hyperglycemia is abnormal high level of glucose in the blood. Glucose appears in the urine and urine volume generally becomes excessive, and this situation is called polyuria. Diabetes mellitus have several types. The first one is type 1 insulin-dependent diabetes, which is characterized by inadequate insulin production by the pancreatic beta cells. Persons with type 1 diabetes require insulin to live and usually require multiple injections daily or continuous infusion through the insulin pump or other device. This form of diabetes accounts for only around 5–10% of cases. This diabetes is common for children and young people the age below 40 years. Diabetes mellitus type 2 or non-insulin dependent diabetes. The main factor for producing of this kind of diabetes, it will be obesity or metabolic syndrome. It's the most common form of the diabetes mellitus. It's common for people who are older than 40 years old. Most people with this form of diabetes produce normal amount of insulin, at least initially, but their tissue do not respond properly to the insulin. And this situation will be called insulin resistance. Type 2 diabetes is associated with obesity. Weight loss through the diet and exercise can be effective treatment of the pre-diabetic condition or glucose intolerance. And it's also be supportive treatment for diabetes mellitus type 2. Diabetes mellitus, what complication of untreated or poorly managed diabetes mellitus could include kidney degeneration, retinal damage, early heart attacks, peripheral nerve problems, and peripheral nerve damages. What about the kidney degeneration? So in this situation will appear diabetic nephropathy. Degenerative changes in the kidney can lead to the kidney failure. Retinal damage or diabetic retinopathy, the proliferation of the capillaries and hemorrhaging at the retina may cause partial or complete blindness. Early heart attacks, degenerative blockage in the cardiac circulation can lead to the early heart attack. For a given age group, heart attacks are 3 to 5 times more likely in the diabetic individuals than in the non-diabetic people. Peripheral nerve problems. Abnormal blood flow to neural tissue is probably responsible for a variety of neural problems with peripheral nerves, including abnormal autonomic function. These disorders are collectively termed like diabetic neuropathy. Peripheral arterial damages, which are rather common during the diabetes mellitus. Blood flow to the distal portion of the limbs is reduced, and peripheral tissue may suffer as a result due to the poor delivery of the nutrition of the oxygen by the blood. For example, reduction in the blood flow to the feet can lead to the tissue death, ulceration, infection, and loss of tooth or male portion of one or both feet. Now it is going to discuss about endocrine tissues of other systems. Many organs and other body systems have secondary endocrine function: intestine, digestive tract, kidneys, heart, thymus, and glands. The intestine generally produces important to coordination of digestive activities, like a gastrin, then secretin, which will affect on the process of digestion. Kidney produces a hormone which you call calcitriol and erythropoietin. Mainly calcitriol is responsible for deliver calcium to the bones and make bones more stronger. And erythropoietin will affect on the red bone marrow for producing new red blood cells. And also it produces the enzyme which we discussed, renin, which is a part of the renin-RAS system, renin, aldosterone, angiotensin-aldosterone system. So, how the calcitriol is going to produce? Production of calcitriol, first of all, we need one point. It's a sunlight. In the skin, cholesterol is going to convert it to the cholecalciferol, which is going to deliver to the liver. Dietary cholecalciferol also, which we receive from the digestive tract, also will deliver to the liver, where we are going to receive intermediated form. In this level, parathyroid hormone, this intermediated form is going to convert it to the calcitriol by influence of the parathyroid hormone, which stimulate what is the function of the parathyroid hormone in this mechanism is stimulation of absorption of calcium and phosphate from the digestive tract. So the vitamin D parathyroid hormone will together responsible for production of the calcitriol. Homeostasis according to the producing of the renin and the blood volume. So, in case when we have the falling blood volume and blood pressure, this will be detected by the kidney. So, falling renal blood flow and oxygen O2 to the kidney. As a result, in which situation we have decreased blood pressure and decreased blood volume. The best example it is a hemorrhage, which could happen as a result we lose blood volume, and besides this we lose the amount of red blood cells which are responsible for the delivery of oxygen. So less amount of oxygen, less amount of blood volume will be detected by the kidney, and kidney is going to be responsible for production of erythropoietin. Erythropoietin will affect on the red bone marrow to increase production of red blood cells. As a result, the new red blood cells will produce, and they will be responsible to some extent to increase blood volume. Besides this, but erythropoietin is responsible to detection of the hypoxia, decreased level of oxygen in the blood. Decreased blood pressure and decreased blood volume will be detected by the extraglomerular cells, which will release renin. We discussed previously that renin is a part of the RAS system, which is responsible for, first of all, secretion of aldosterone. Aldosterone will be responsible for reabsorption of sodium ions, which also will responsible to increase level of blood volume in the blood volume. Besides this, the level due to the decreased level of blood volume will produce a hormone which is called antidiuretic hormone, which will be responsible for reabsorption of water. So together, reabsorption of water and sodium will influence on increasing of blood volume and blood pressure. Producing of ADH will be stimulating by the such symptom which is called thirst. The heart. What hormones produces the heart? Heart produces natriuretic peptide. What is the main effect of this hormone? When blood volume becomes excessive, this hormone have opposite effect to angiotensin 2, and it's responsible to for excretion of the water from the blood. So as a result, in this way, blood volume will decrease. What part of the heart will detect the excessive blood volume? The right atrium, due to the is responsible for detection of the excessive amount of blood volume through the extent of the cardiac muscles, and as a result, natriuretic peptide is going to release an effect on the kidney. As a result, kidney, and it was responsible for excretion of the water from increase of excretion of the blood volume. So as a result, blood pressure will decrease. Thymus generally produces a hormone which is called thymosin, blend of thymic hormones that help develop and maintain normal immune defenses. Gonads. Testes. They produce androgens in intestinal cells. Testosterone is the most important male hormone, and secretin, and also testes produces inhibin in nerve cells. What is the main function of the testosterone? It's responsible for supporting differentiation and physical maturation of sperm. Ovaries, they produces estrogen, and principal estrogen is estradiol. After ovulation, follicle cells recognize intercorpus luteum and release estrogen and progestins, especially progesterone. Adipose tissue is responsible for production of leptin. It provides the feedback control for appetite, controlled normal levels of growth hormone releasing hormone, gonadotropin gonadotropin synthesis. So in here we have once more for revising what function of the hormones. For instance, heart produces natriuretic peptide, which affect on the kidney, increase water and salt loss by the kidney, decrease thirst and suppress secretion of antidiuretic hormone. Kidney, which produces erythropoietin and calcitonin, erythropoietin effect on the red bone marrow, stimulate red blood cells, and calcitonin will effect on the bones, intestinal lining, stimulate calcium and phosphate absorption, stimulate calcium release from bone, and inhibits parathormone secretion. Intestine responsible for production of secretin, gastrin, cholecystokinin, which generally will coordinate function of digestive tract. Now just go on to the hormones interaction. Hormones interact to produce coordinate physiological response. When the cell receives instruction from the two hormones at the same time, four outcomes are possible: antagonist effect, opposing, synergic effects, additive effect. So when they will suppose the function of each of the hormone. Permissive effect, when one hormone is necessary for another to produce effect. Integrative effect, when the hormones produces different and complementary results. Hormones important to growth. It's a growth hormone, first of all. It's steroid hormones. It's insulin, then parad hormone and calcitonin, and reproductive hormones, which produced from the gonads. Growth hormones in children is responsible for development of the skeletal muscle. In adults, it's responsible to maintain normal level of glucose in the blood and mobilize lipid reserves. Thyroid hormones, if absent during the fetal development or for first year, generally it's responsible for problems with the nerve system development, which is called cretinism. Nerve system fails to develop normally and mental retardation results. If T4 concentration declined before puberty, normal skeletal development will not continue. Insulin. Allow passage of glucose and amino acids across the plasma membrane and as a result for storage them and synthesize or for storage of glucose in case of the glycogen and synthesize proteins from the amino acid. Parathyroid hormone and calcitriol, they promote absorption of calcium phosphate from the digestive tract and deposition in the bone. Inadequate level of cause weak and flexible bones. Reproductive hormones, androgens in males and estrogens in females, stimulate cell growth and differentiation of target cells, produce gender-related differences in the skeletal proportions, secondary sex characteristics. So, let us repeat once more. Clinical implementation of endocrine malfunction, so growth hormone. Overproduction of the growth hormone will be related to the gigantism or acromegaly. It's happened with excessive growth. Antidiuretic hormone, example of disorder will be diabetes insipidus, which is responsible due to the symptoms increased body weight and water content. The main symptoms of the diabetes insipidus is polyuria and dehydration and thirsty. Thyroxine, T3 and T4 levels, which could hormones, which could lead to such diseases like myxedema and cretinism when we have the hypofunction of thyroid gland. The main symptoms will be low metabolic rate, low body temperature, impairment for the mental development and physical. Parathyroid hormones, hypoparathyroidism, which could cause such symptoms like muscle weakness, neurological problems, formation of dense body, tetany due to the low level of calcium in the blood. Hyperparathyroidism is which will cause the neurological also problems, mental disorders, muscular problems due to the high level of the calcium in the blood. Also, okay, mineralocorticoids, hyperaldosteronism. The main symptoms of it will be polyuria, low blood volume, high level of potassium, and low level of sodium. Or aldosteronism, which will have adverse effect, increased level of sodium, low level of potassium, and increased blood pressure. Glucocorticoids. So when we have a deficiency amount of hormones, lead to Addison disease. The main symptoms will be inability to tolerate the stress, mobilize energy reserves, or maintain normal level of glucose. Cushing disease, which the main symptoms of it will be excessive breakdown of tissues, proteins, lipid reserves, impairment of glucose metabolism. I'm sorry, it's my cat. Then estrogens, hypogonadism, which will cause the sterility, lack of sex, secondary sex characteristics. And hyperfunction of the estrogens will lead to the adrenal syndrome. Overproduction of androgens by Zonal Reticularis and Adrenal Cortex leads to the muscularization. Then premature sexual maturation and related behavioral changes. Adrenal syndrome in males will call main symptom or will be gynecomastia. It's a normal production of estrogens, sometimes due to the adrenal glands or intestinal cells tumors, leads to the breast enlargement. Okay. The hormone responses to how the hormonal responses to the stress. So first of all, it is a general adaptation syndrome, also called stress response. How body responds to the stress causing factors is divided. It will be divided in 3 phases. It is alarm phase, resistance phase, and exhaustion phase. During the alarm phase, first of all, is going to be activated the autonomic nervous system sympathetic division, which will be responsible to increase mental alertness, increase energy used by all cells, mobilize of glycogen and lipid reserves, change in circulation, reduction in digestive activity and urine production. Also, sympathetic division we discussed previously will affect on adrenal medulla, which is going to release epinephrine and norepinephrine, and generally they will have the same effect as we described previously. It also could be increased production of increased heart rate, increased respiratory rate, and increased sweat gland secretion. The next stage, it is the resistance stage, during which will all activated not only by sympathetic stimulation, will activated not only adrenal medulla but pancreas, which is responsible to release glucagon. The main function of glucagon we discussed previously is to break down of glycogen to reproduce glucose, increase its level in the blood. Lipids are going to release by the adipose tissue and amino acids from the skeletal muscles. Fat acids and amino acids are going to be used further for gluconeogenesis. Growth hormone also will take part in this case to increase level of glucose through the influence on the metabolism on the carbohydrates and protein and fats. So another stage which is going to activate during the resistance phase is increased production of adrenocorticotropic hormone, which will affect on the adrenal cortex and producing of the glucocorticoids. Glucocorticoids will be responsible for elevation of the level of the blood, responsible for increased level of glucose in the blood by the breaking down of glycogen through the liver. Then mineralocorticoids and antidiuretics hormones, they together will be responsible for increased blood pressure, conservation of cells and water, and loss of potassium ions. And the last stage, it's the exhausting phase. which is presented by the collapse of the vital systems, exhaustion of the lipid reserves, cumulative structural and functional damages of vital organs, inability to produce glucocorticoids, and failure to the electrolyte balance. How the hormones affect on the behavior. Hormones could changes intracellular capabilities, memory, learning process, and emotional states. They affect behavior when endocrine glands are oversecreting or undersecreting. Thank you for your attention. The lecture is over.